In the name of Allah, the most merciful and the most beneficent, myself, Dr. Maimuna Azhar, by profession I am a physiotherapist and also demonstrator. In the last lecture, we have studied about articular cartilage, and today we are going to go through articular fibrocartilage. So, articular fibrocartilage, the word is telling its meaning. Articular means joint. Fibro means fibers are present inside, and cartilage, the structure we have studied in detail in last lecture. I am going to draw it again to re-explain it. For example, the cartilage contains chondrocytes, and inside of that collagen fibers are present. This was the structure of cartilage. But when in this cartilage we add fibers, it will become fibrocartilage. And articular fibrocartilage means this fibrocartilage is present in between articular surfaces. For example, these are two articular surfaces. In between them, articular fibrocartilage is present. This articular fibrocartilage, this structure which is present between two articulating surfaces, this is soft tissue, and it is present in two types, in the form of disc and in the form of menisci. This basic disc is present in our intervertebral joints. As we know that we have vertebrae. We have a vertebral column which starts from this area of the neck and goes downward in the center, go downward. This is the cervical region, this is the thoracic region, this is the lumbar region, and this is the sacral region. So from cervical to lumbar region, intervertebral discs are present in between the vertebrae. So fibrocartilage is present firstly in the form of disc in intervertebral disc, and also it is present in pubic symphysis. What is that pubic symphysis? For example, this is our pelvis. Pelvis is this region of our body. So in this pelvis, two hip bones are present. This is a hip bone and this is a hip bone. Where these two hip bones are uniting, a disc is present. This region, this is basically a disc which is uniting the pelvis, and so that's why it is also articular fibrocartilage and it is called pubic symphysis. Now this intervertebral disc, we should go into detail and we should learn what is the basic structure of that intervertebral disc. This intervertebral disc is drawn in this region. It consists of two parts, nucleus pulposus and annulus fibrosus. This nucleus pulposus is the central gelatinous material which is very soft. And the outer region, this black one, it is indicating annulus fibrosus where mainly fibers are located. Outer part which is hardened, while inner part which is nucleus pulposus which is softened region of that area. And they are designed this way to absorb shock. There are multiple functions of this region which we will study after studying the menisci. Now coming towards the menisci, which is also fibrocartilage. We know that knee joint contain two bones which are uniting this way. If we go into detail of the lower bone, this bone for example, we remove out this upper bone and we go into detail of that tibia bone which is present on the lower side, and we take a slice of this bone, outer slice of this joint, and that slice is drawn in this way. Then this is the cross-sectional picture of our tibia from that joint view. This is the medial side and this one is the lateral side. These two green pigments which are present over here, these are fibrocartilage. Now this medial side, the fibrocartilage is C-shaped, which means crescent shape, while on the lateral side it is more of circular shape. The medial fibrocartilage or medial menisci, it is bigger in size, while the lateral one is smaller in size. Comparative to that, it is circular and it is covering the larger area surface. While it is bigger, but it is covering the less area of articulating surface. As we can see that this part, it is not being covered by menisci. So there are multiple tasks and multiple functions which are performed by the menisci, intervertebral disc and pubic symphysis, where the first one is load distribution. For example, a load is coming from upside. This bone will transmit this load to this bone, but this disc is playing a very important role, that it is making the load transmission very accurate. Also with that, improvement of fit of articulating surface. For example, we have two discs. We take two discs and we want to join them. What we will do, we will put some cement inside. So this articulating fibrocartilage, this soft material is acting like the cement in between, so it gives a proper fit. And also the peripheries, a bone is having edges and peripheries, it will also protect these peripheries by giving a proper fit inside. Then lubrication and shock absorption. If a shock comes in the form of stress, it can be compressive force or it can be tensile force. In any kind of force, the shock will come, and these part, the articulating fibrocartilage can absorb shock very easily and can transmit the load in an accurate manner. And also it lubricates in our joint. Like we have studied synovial joints where synovial fluid is present and the bones are not properly in contact with each other. But here the bones are directly in contact with fibrocartilage, soft material, which is giving lubrication to that region. So this was all about articular fibrocartilage. If you guys have any query, any questions, you guys can ask me, you can contact me, you guys can comment here. I will try to make better videos for you, and as long as I am proceeding my lectures, I will try to take more improvements for all of you. The way you will say me, I will try to do that. Thank you so much.